Good morning, friends. I'm Dr. Nazar. Today we will continue with the same images and pictures discussions one by one. We'll go further. And this today's case of anal fistula. Here you can see the picture. This is the case of anal fistula. The causes of anal fistula are acute and chronic perianal abscesses, or recurrent infections in the perianal region can cause fistula. Whenever we see such type of the picture in exam, we can think about the Crohn's disease as well. So if it is recurrent, then we have to go for the MRI and endoscopic ultrasound to rule out the any other disease. Like we have to keep in mind that Crohn's disease is the one of the factor of this anal fistula. So Uh, this we have to keep in our mind. In treatment, surgery, drain the abscess and lay open the fistula, or fistulectomy or fistulotomy. We have to go for the treatment of the anal fistula. So this is the case of anal fistula. Our next image is the Horner syndrome. Here you can see in Horner syndrome there will be a ptosis, meiosis, and anhidrosis. So here you can see the ptosis of the left eyelid, as I can show you the picture. So whenever such type of pictures come in the exam, we have to think about the Pancoast tumor. This is the tumor of the lung and posterior inferior communicating artery, dissection of the aorta, and carotid dissection. So these all are the causes of Pancoast tumor. Not Pancoast tumor, but these all are the causes of the Horner syndrome. So whenever this syndromes or this type of picture comes in the exam, we have to think about these all causes. This could be a Pancoast tumor, PICA, dissection of the aorta and carotid. So our next picture is the psoriasis of the buttocks. This is the image. This picture shows the psoriasis. So this is erythemattic patches and silvery scales. So this diagnosis is a clinical diagnosis, but for the treatment, topical steroids are used. The other one sign they have mentioned in this picture, that's Auspitz sign. So this defined as a bleeds when picked. Our next picture is the herpes zoster virus. This frequently comes in the exam. This picture is very important. If you'll see this, these are the herpetic lesions. I would closely show you. In this scenario, they mostly ask about the treatment. So for the antiviral treatment, it's only required when the patient present within the 72 hours. If more than 72 hours, then antiviral treatment is not needed. Only painkillers. If patient is having a pain, mostly patient will have a pain, so we have to prescribe the pain medicines. But if after 72 hours present with the same lesions and patient is having some complications, then we have to give the IV antiviral and IV steroids as well. So this is the picture of the herpes zoster virus. This is the X-ray image of sigmoid volvulus. This is another picture of swelling on the left side of the neck. So whenever such type of the swelling comes in the exam, we have to think about these are the supraclavicular lymph nodes can be because of esophageal or mediastinal or lung CA. We have to rule out all these causes, and as they have mentioned, if it is right supraclavicular, then esophageal, mediastinal plus lung, these malignancies we have to rule out. If it is on the left side, then ovary, stomach, pancreas, and gallbladder. So we have to be very careful to see on which side these supraclavicular lymph nodes are present. So if it is on the right side, then esophageal, mediastinal, and lungs malignancies we have to rule out. If it is on the left side, then ovary, stomach, and pancreas and gallbladder. So these are malignancies we have to keep in our mind and we have to rule out one by one. This they have given the image of X-ray chest, which shows the Penco's tumor. As we few slides before we have gone through the Horner syndrome. So this is the Penco's tumor, which is one of the cause of Horner syndrome. So in this patient will present with the shoulder, arm pain, Horner syndrome will be there, weakness and atrophy of the hand muscles. Uh, Patient can present with these all features. So now this one of the cause we we few slides before we have gone through this. So this is the Penco's tumor. Remaining other pica and carotid dissections, these were the causes of the Horner syndrome. This is the Penco's tumor. As I've encircled this area, this is the Penco's tumor. White opacity in the left upper region of the lung. Our next picture is a benign duct papilloma. Here you can see the presence of blood in the center of this duct, and this blood stain discharge from the single duct is typically due to benign duct papilloma. So this is the case of benign duct papilloma, and for the investigation we have to go with the mammography or ultrasound to get it confirmed, and in treatment usually exploration and excision is required. So this is a very important picture we should keep in mind. Though it's a blood, commonly whenever we see the blood we think about the malignancy, but this is not malignant tumor. This is the benign duct papilloma. So this is the benign. Our next slide is the CT of the chest, which shows left pneumothorax. In this image, they have given the CT scan image of chest, which shows the left pneumothorax, and also they have given the chest X-ray as well, which shows the right pneumothorax. So here you can see the right-sided pneumothorax, though this picture is not very clear, but anyway, if it comes in the exam, then we have to see that if it is large pneumothorax, then either this trachea is centrally placed or not, is it deviated, If it is deviated, then we can think about this. Or if they have given the features or examination findings, if they have mentioned, then we can diagnose. If we are having a confusion with the picture, then we can think other features if these are given in the in the question. So anyway, this is the pneumothorax of the right side of the chest, and treatment according to the severity. If it is mild, moderate, or severe, then accordingly we have to treat. Our next picture is the brachial cyst. Here you can see this left side swelling in the upper anterior triangle covered by part of sternocleidomastoid muscle. So this is the picture of brachial cyst. Diagnostic investigation is CT with contrast, and aspiration is needed. Our next picture is the Dupuytren contracture caused by the alcohol, then commonly caused by the alcohol, then diabetes and trauma. Trauma can be the cause of Dupuytren contractures. So treatment is the conservative or fasciotomy is required. So this is the case of Dupuytren contracture. This is our last slide. It's a very important slide. It's a very important picture. Here you can see this is the uh, case of lentigo melanoma, and here you can see the pigmented lesion on the face. It's because of chronic or long-standing sun exposure can cause such type of the pigmentation. So this is called lentigo melanoma. This is precancerous condition. We have to uh, keep in our mind that this is the precancerous condition. So early recognition, so early detection and treatment are very important to prevent progression to invasive melanoma. So we have to go for we should refer this patient to the plastic surgeon. This because this needs excision with 5 mm margin. So this case, we have to refer on urgent basis to the plastic surgeon for the excision of this pigmentation, because if we will not diagnose early, if we did not go for the further treatment, then this can convert to the invasive melanoma. So today is our last slide. Hopefully these images and pictures will be helpful in your upcoming exam. Thank you very much.